DFL Governor Mark Dayton is admitting there are some serious issues with the health care program he once strongly backed.
I'm not trying to pass the buck here, but the reality is the Affordable Care Act is no longer affordable to increasing numbers of people.
About 250,000 Minnesotans are insured through the state's health insurance exchange. Just last month, state officials announced health care plans could skyrocket more than 50% for people insured under MNsure. Kate Raddatz following this story from this newsroom this morning. Kate?
Well, Jason, Governor Mark Dayton stepped away from one of his signature platforms yesterday, saying changes to MNsure are critical. Dayton says the Affordable Care Act has had some success in terms of insuring more than 20 million people across the country and providing access to people with pre-existing medical conditions. But it also has some serious deficiencies. About 5% of Minnesota's population is insured under MNsure. That's about 250,000 people. As of next year, those people could be paying anywhere from 50% to 67% more for individual health care premiums next year. The increases are because health insurance companies simply didn't expect to cover as much as they have. The state's largest insurer, Blue Cross Blue Shield, is also pulling out of the individual market, forcing thousands to shop for new plans. Republicans have long criticized the program.
Frankly, I think it's a good step that the governor is now admitting that most Minnesotans can't afford this. And I think that's a good first step to us now being able to work together to take some action to fix this so that we can find a solution that will get Minnesotans the health coverage they need at a cost they can afford.
Dayton says there are things that can be done on the state and federal levels to help fix the problems, and alluded to talking more in depth about the state's approach in the coming days. Open enrollment for MNsure begins on November 1st.
Kate, Governor Dayton's comments already becoming a part of the national political campaign and presidential campaign. Is there anything that can be done in the short term to try to get costs down?
Well, the legislature doesn't go back into session until January. Open enrollment ends at the end of December, so it's not clear exactly what can be done to fix the situation. But Representative Dowd says both parties need to get together as soon as possible to start working on a solution. Governor Dayton says he won't discuss the possibility of a special session, though, until after the election.
All right, Kate, thank you.